and welcome to my channel, Roadmap to Wellness. I'm Dr. Pushpa Chauhan, and in today's video, we're diving into one of the most overlooked aspects of mental health, how depression can wear a disguise and show up in ways we often dismiss as being tired, burnt out, or in a funk. We all experience stress. It's just a part of life, but sometimes stress begins to affect us in subtle ways that go unnoticed until one day we no longer feel like ourselves. I'm bringing up this topic of depression as it is something that each and every one of us will deal with at some point in our lives. In this video, I'm going to share 2 real-life examples, break down some hidden signs of depression, and give you some practical tools to understand when it's time to seek help. Before we get started though, please note that while I am a licensed psychologist, the information provided in this video is for educational and informational purposes only and is not intended as a substitute for professional psychological advice, diagnosis, or treatment. So if you are experiencing psychological distress or need personalized support, please consult a qualified mental health professional in your area. So let's get started. At some point in my early 50s, I went through a period of a couple of months where I felt like I had hit a wall. Normally, I'm an optimistic, calm, and happy person who likes to get my obligations done and often spend my free time researching things, reading, or otherwise being productive. Sure, I have my lazy days of lounging around like most people, but certainly not days or weeks of this behavior. At this particular time in my life, I was dealing with some family stress for quite some time, feeling burnt out, and other than being at my job, I had no motivation to do anything else. It seemed like household chores were so difficult to get done that all I was doing after work was sitting on my iPad playing card games for ridiculous amounts of time, which is not like me. One thing I always notice in myself is when I tend to become somewhat quiet or constantly have repetitive thoughts in my head, that's my clue that something is wrong, and I was experiencing a lot of this. I was just living life on autopilot in the state, and after several weeks of feeling like this, I was looking at my garden one day and noticed it was a mess and there were more weeds than flowers. Now, given that I love gardening, this was highly unusual. But the fact that on that day I looked at it and had no desire to remedy that situation and went back to playing games on my iPad, that was when it suddenly hit me. I realized I was dealing with low-grade depression. Now, I knew depression often came from some kind of loss, and so I kept trying to figure out what I had lost, but nothing came to mind. Then one day, while a client was talking about the loss of a hope or a dream, a light bulb went off in my head. I had connected the dots for myself. The depression wasn't from an obvious loss or an actual loss. It was the fear of losing someone important to me. The current situation was so similar to a past experience that it had reactivated feelings from an actual loss 20 years prior. The fear of it happening all over again was just as powerful and had overwhelmed me. In eagerness to get over this emotional state, I made some small changes to my routine. I tried some supplements, I forced myself to do things, I talked to my friends about the stress I was feeling, and luckily, within about 2 weeks, I noticed the mental fog had lifted. The ruminating thoughts had vanished, and my desire to live fully had returned. And in case you're wondering, yes, my garden did survive. Let me share another story, this time about my father. My father too had an optimistic attitude about life, was generally a happy person, and enjoyed being social. However, after being diagnosed with kidney failure and needing to have dialysis, he started to become irritable and impatient about many things. He was first placed on peritoneal dialysis, which is a form of dialysis that can be done at home on a daily basis, but one that requires overnight treatments. Although this is convenient in the sense it could be done at home, it is rather intense and requires the help of another person besides the person having the dialysis. In this case, it was my mother helping him to do the majority of the stuff and my brother stepping in as needed. With this new procedure, he was undergoing a lot of changes in his life, and it was very different from the life he had been living prior to this treatment. He was having to keep a strict schedule so he could start the nightly process on time. He was feeling discomfort with the solutions in his body. He had difficulty sleeping as he was hooked up to the machine all night, and one that would sometimes set off alarms if it malfunctioned. And he also had to have frequent doctor's visits. All of this was new stress for him and for my mother. After a period of this new lifestyle change, my father became irritable and short-tempered, and my mother became the recipient of his bad moods. Her feelings were constantly getting hurt as he would snap at her when she was trying to help him with the dialysis process or something else. He would also stay in his sweats all day instead of wearing a shirt and pants like he normally did, and would watch TV all day long, which was also unlike him. He had little motivation to do anything and didn't seem to be engaged or interested in conversations with others. As my mother spoke to me about this behavioral change and the frequent irritability, to most people it may have looked like frustration or just being difficult, but to me it looked like depression. I had asked my mother to accompany my father and talk to his primary care physician about the changes in behavior and mood. When he was evaluated by his PCP, he showed enough symptoms of depression to warrant getting on an antidepressant. After a month or two of being on the medication, my father was more motivated, more peace with his new lifestyle, and better connected with us. Although my father was a man who didn't generally express his feelings, I knew he might be coping with feelings of loss of the things he once enjoyed. Once he started to feel emotionally better, in my own ways I tried to help my father by getting him to see that just because he had become dependent on this machine for his physical well-being, he could still have a relatively normal lifestyle with a few adjustments. The one thing that he loved to do was to travel, so we made sure there were plenty of opportunities for that to happen, even though he was on dialysis. The medication was a godsend. If anyone has ever had to experience this, it is extremely difficult to take care of a person or help a person that is always angry, irritable, and not appreciative of the caregiver's effort. When more depression symptoms occur, it can certainly affect the entire family. Now let's look at what depression looks like. Most people think that depression is when a person is sad and crying, but as you can see from my two examples, depression doesn't always show up as sadness. Sometimes it shows up as irritability, withdrawal, lack of motivation, or a loss of interest in who you used to be. For strangers working with a person feeling like this, they may not even know it's depression and just think that these behaviors are simply a part of the person's personality. Only a person who has regular contact with a person experiencing depression would notice these changes. Emotionally, depression might look like low mood or sadness, loss of interest or motivation, irritability or emotional numbness, anxiety or emotional sensitivity, and difficulty feeling joy. Physically, it often affects changes in appetite or weight, sleep disturbances, fatigue or low energy, and physical aches and pains with no clear cause. Mentally, you might also notice trouble concentrating or making decisions, negative self-talk, feelings of guilt or worthlessness, or suicidal thoughts or ideation. And depression isn't a one-size-fits-all. It comes in mild, moderate, and severe forms. The more symptoms you experience, the longer they last, and the more they impact your daily life, like work, self-care, and relationships, the more serious it may be. And no, skipping a shower once in a while doesn't mean you're doomed, but if it's becoming a trend, it's worth checking into. You might be wondering what causes depression, but it's not always simple because depression has many roots. It can come from chemical and hormonal imbalances. This is the reason why some women experience postpartum depression or others experience sadness or moodiness around their cycles. There is one chemically that many people may not be aware of. Medications like prednisone and some others have also made some people feel depressed after taking them. Depression can also be more prevalent in those who have a family history of depression. Chronic stress can cause changes in our neurotransmitters, which are chemicals that regulate our mood. The reduction of serotonin, dopamine, and norepinephrine increases the risk of depression. Sometimes after a trauma, people can feel numb, and this over time may lead to them to lose interest in connections, their activities, or have feelings of worthlessness, guilt, or helplessness. Social connection plays a vital role in emotional well-being. Social interactions provide validation, empathy, and support in times of stress and acts as a buffer against depression. Major life changes or losses like the death of a loved one, divorce, job loss, moving, retirement, or a serious illness can all disrupt a person's emotional, psychological, and physical well-being and may lead to depression. The life changes or loss may impact a person's identity, or it may cause a person to have loss of meaning or direction in their life. Although these are some factors that cause depression, it's not always the case. Here's this tricky part. Sometimes it's not about what's happening today. Sometimes it's about old wounds, stressful events, unresolved pain from the past that get reactivated when life hits hard. If you ever felt low and can't understand why, then ask yourself, what have I lost, or what do I fear losing? Sometimes that question can be the key to healing. If you can identify it, then you can do something about it. Here's the good news. Depression is treatable. Here are some things you can do that will help. For mild depression, exercise regularly. Even taking a walk outdoors can help. Maintain a good sleep schedule. Eat a balanced diet. Journal or try mindfulness meditations. Use self-help tools or apps. Or join a support group. For moderate depression, consider therapy, individual or group. Medications may be helpful or necessary. Stay socially connected and structure your day with small, achievable goals. For severe depression, seek professional help immediately. Crisis services or inpatient care may be necessary. Medication and intensive therapy like inpatient, intensive outpatient, or partial hospitalization programs are often required. Never ignore suicidal thoughts. Reach out for help immediately. Even though a person may not have attempted it, just contemplating it is a cry for help. Treatments work best when they are personalized and addresses the mind, body, and environment. So there you have it. If you've been wondering if your stress might be something more, now you have some tools to reflect and take action. Comment below if this resonated with you or if you've ever felt low without knowing why. Your story might just be the message that somebody really needs to hear today. If you found this video helpful, then please hit the like button or consider subscribing. Please share it with your loved ones and your friends so that they too can be aware of the symptoms to be on the lookout for when life gets stressful. Take care of yourself and remember, it's okay to ask for help. You don't have to go through it alone. I thank you for watching, and until next time, be well.